Hello, I'm Dr. Robert Lelouch, board-certified OBGYN physician with over 30 years of clinical experience. Today we're going to talk about pessaries and their use in pelvic organ prolapse. So, pelvic organ prolapse may represent where your uterus has descended or fallen down, where your bladder has fallen down, called a cystocele, or your rectum has fallen down, called a rectocele, or the top of your vagina is falling down if you've had a hysterectomy, called an enterocele. This anatomic change is your tissues herniating into your vaginal space. There are many levels of that, and you might have a mild degree and no symptoms. That's pretty common and nothing needs to be done about it. But if you have a substantial amount and substantial symptoms with it, then you might need an intervention. There are pessaries and there are surgical interventions, and we encourage everyone to try a pessary or be evaluated for a pessary before going to a surgical option, because as many as 90% of women can be treated effectively with a pessary. A pessary is a little silicone or rubber plastic donut shaped device. There are many different shapes. Some are shaped as cubes, some are like a donut, some have a little support in them, some have a little ridge on them. But the basic idea behind it is to occupy space in your vagina, hold things up, relieve your symptoms, and avoid a surgical solution. If you do have a little bit of a bulge and a physician or your clinician mentions it to you, but you aren't having any symptoms, you don't necessarily need anything. But if you are feeling pressure or having problems urinating, having a bowel movement, you need to use splinting, use your fingers vaginally to help empty your bladder or empty your rectum, or you have discomfort with intercourse or discomfort and pressure after standing for long periods of times, then you might have one of those problems that needs intervention. That can be evaluated by your physician, and then you can be fitted with a pessary. They will do their best to find the right size for you. It is a bit of a trial and error procedure, and finding the optimal that is not so small that it easily falls out and not too large that it causes pressure, ulcerations, discomfort is the key. Generally speaking, when I have a patient who gets fitted for a pessary, we fit it in the office and then have them do normal activities of home, walk around, lift, tie their shoes, sit, stand for about 10 minutes in the office, so that we can see if they're going to feel comfortable, feel that the problem is solved. That's a great part about a pessary, is you instantly can tell that it holds things up and it eliminates that pressure, and also ensure that there's no significant pain or discomfort. If that works out, then generally I see patients a week later to make sure they're doing okay. It's a very rare circumstance, but it's theoretically possible that a pessary fits so tight that it interferes with your ability to void. So if you just have a new pessary, make sure that you're paying attention, you're able to go pee within the next 6 hours, drink some fluids. If you're having difficulty, you might need to take it out. If you can't, then you need to go back to your physician. Obviously, you need to be able to urinate. The reason to check again a week later is to make sure you're fitted correctly. Your physician might pick a different time period. Make sure you're not getting some pressure or irritation. And then after that, we graduate the time. Sometimes I see a patient a month later, and then afterwards, every 3 to 4 months to every 4 to 6 months, or some recent studies saying that if everything is stable, up to every 6 months is fine. If you're able to take it out yourself, maintain it, clean it, you might need only yearly visits after you've gotten stabilized. Not all women are able to take them out. If you're older, have arthritis, sometimes it's difficult. You need to see your physician to get it out. Other younger women or those who are dexterous are able to take them out, clean them themselves. If you do plan to have intercourse, you generally have to take the pessary out to do that. But a pessary can solve the problem, take away the discomfort, take away the discomfort, and really solve your problem without surgery. Now, surgery is a bigger deal, and surgeries have risks. Surgeries sometimes involve meshes, and those have some risks too. You would have to address this with your physician specifically, but with a 90% success rate, finding a pessary, we encourage you to try it. A lot of women are hesitant to try it, but once they do and they find out how simple and easy it is, they find that they're pleased with it and it works out well. So I hope you found these comments helpful, and please leave your notes. Thank you.